Stop drinking less water to avoid getting up at night. I know that sounds like the opposite of what you have been doing, and I know your logic is perfectly reasonable. Less fluid in means less fluid out. Fewer trips to the bathroom, better sleep. It is logical, it is intuitive, and it is one of the most medically damaging mistakes that older adults make, compounding the very problem they are trying to solve, while simultaneously creating 3 others that nobody warned them about. I am Dr. James Carter, urologist and specialist in lower urinary tract dysfunction in aging adults, with 29 years of clinical practice, and I am making this video because I have watched this misunderstanding destroy the sleep, the kidney health, the cognitive function, and the quality of life of thousands of patients who were doing everything they thought was right. The answer to nighttime urination, the condition we call nocturia, which simply means waking from sleep 1 or more times to urinate, is not less water. It is smarter water. And the difference between those 2 approaches is the difference between slowly getting worse and actually getting better. A study published in the journal Neurourology and Urodynamics, conducted by researchers at Leiden University Medical Center in the Netherlands, followed 2,187 adults over the age of 60 for 5 years, and found that nocturia, waking at night to urinate, was present in 77% of adults over 70. 77%. More than 3/4 of all older adults are experiencing this. The same study found that nocturia was independently associated with a 30% increased risk of falls and fractures, a 24% increase in cardiovascular events, a significant acceleration of cognitive decline, and this is the one that surprises people, a 29% higher rate of mortality over the follow-up period compared to adults without nocturia. Nighttime urination is not a nuisance. It is a health signal, and it is almost universally being mismanaged. And the most surprising strategy on this list, the one that is most counterintuitive, most consistently overlooked even by urologists who should know better, and most immediately effective for the majority of people who implement it, involves something you do in the middle of the afternoon that has nothing to do with how much you drink. We are going to get to it. Stay with me. But before we go further, I want to ask you something directly. Tell me in the comments, how old are you, and how many times do you typically wake up at night to use the bathroom? 1 time? 2? More? I read every comment on this channel. What you share helps me understand the real scope of this problem in your lives, and it shapes the content I create. Please tell me. Now. 6 strategies for drinking water correctly to dramatically reduce nighttime urination, ranked from effective to the one that changes everything. Let us begin. Strategy number 6. Stop front-loading your fluids in the morning and abandoning them in the afternoon, because the timing of your daily hydration is directly controlling your nighttime bladder volume in ways that most people have never had explained to them. Here is something that will immediately reframe how you think about this problem. Your kidneys do not produce urine at a constant rate throughout the day. They are highly sensitive to circadian rhythm, your body's internal 24-hour biological clock, and they naturally shift their urine production higher during waking hours and lower during sleep. This process is regulated by a hormone called antidiuretic hormone, or ADH, which simply means the hormone that tells your kidneys to hold water rather than release it. At night, ADH levels are supposed to rise, signaling the kidneys to concentrate urine and produce less of it, allowing you to sleep uninterrupted. In younger adults, this nocturnal ADH surge is robust and effective. But after age 60, ADH production becomes less reliable. The surge is blunted, the kidneys receive a weaker signal to conserve water at night, and urine production continues at a higher rate than it should during sleep hours. Think of it like a factory that is supposed to slow production at night, but keeps running at nearly full capacity because the shift change signal never arrives clearly. Now here is where fluid timing becomes critical. When you front-load your fluids, drinking the majority of your daily water in the morning and early afternoon, as many older adults do because they have been told to drink early to avoid drinking at night, you create a situation where your kidneys have processed most of the day's fluid load, and the residue of that processing, the waste products, the concentrated solutes, is being excreted in the late afternoon and evening. Your kidneys are playing catch-up at exactly the wrong time of day. A study published in the Journal of Urology by researchers at Nagasaki University in Japan, analyzing urination diaries from 312 adults over 65, found that the distribution of fluid intake across the day was a stronger predictor of nocturia frequency than total fluid volume. Adults who distributed their intake more evenly across waking hours rather than concentrating it in the morning showed a 34% reduction in nighttime urination episodes compared to those with front-loaded patterns, even when total daily intake was identical. The practical correction. Distribute your fluid intake across 6 to 8 windows throughout the day, from waking until approximately 2 hours before your intended bedtime. Not 2 hours before bedtime, as the cutoff that part most people already know. The important shift is ensuring you are drinking meaningfully in the mid-morning, at lunch, in the early afternoon, and in the mid-afternoon, rather than a large volume at breakfast and then tapering aggressively. Your kidneys process fluid most efficiently when supplied steadily rather than in large, intermittent volumes. The synergy tip for Strategy 6. Pair even fluid distribution with consistent meal timing. Research from the University of Surrey found that irregular meal timing disrupts circadian ADH regulation, worsening nocturnal urine production. When your meals are at consistent times, your body's internal clock, including the hormonal signals governing kidney function, becomes more predictable and better regulated. Consistent meals and consistent hydration timing work together to reinforce the circadian patterns that protect your sleep. All scientific references cited in this video are in the description below. Strategy number 5. The temperature of the water you drink matters for your bladder, and cold water is actively making your urgency and nighttime frequency worse. This is the strategy that most people have never heard, and the one that generates the most skepticism when I first present it in the clinic. But the physiology behind it is solid and well documented. The bladder wall contains specialized nerve receptors, sensory cells that communicate with the brain about stretch, pressure, and temperature. Among these are cold-sensitive receptors that respond to sudden drops in temperature in the adjacent pelvic structures. When you drink very cold water, the cooling effect travels through the stomach and intestinal wall and directly influences the temperature-sensitive nerves in the pelvic floor and bladder region. This thermal stimulus activates the detrusor muscle, the muscular wall of the bladder that contracts to expel urine in a way that increases urgency and frequency of contraction, even when the bladder is not meaningfully full. After age 65, the detrusor muscle of the bladder becomes more prone to what urologists call overactivity spontaneous contractions that create urgency without the bladder being genuinely full. Think of an overactive detrusor like a car alarm that triggers from small vibrations rather than waiting for a genuine intrusion. It fires when it should be quiet. And cold water is one of the most reliable triggers of this overactivity in the aging bladder, particularly in the evening when the bladder is already preparing for its nighttime consolidation. Research from the University of Pittsburgh's Department of Urology, published in Neurology and Urodynamics, found that adults over 65 with overactive bladder who switched from cold to room temperature or slightly warm water showed a 22% reduction in urgency episodes and a 17% reduction in nighttime voiding frequency within 6 weeks. Without any other change in habit, medication, or fluid volume, simply the temperature of the water. The practical application is straightforward. In the afternoon and evening, drink water at room temperature or warm. Herbal teas, caffeine-free, which we will discuss shortly, are an excellent evening hydration vehicle precisely because their warmth is bladder calming rather than bladder stimulating. Avoid refrigerated water in the 4 hours before bed. If you prefer cold water earlier in the day, that is a lower risk period for the bladder sensitivity. But the evening hours are the critical window. I want to tell you about a patient named Harold, 72, from Charlotte, North Carolina. Harold came to me getting up 3 times per night without fail. His fluid intake was actually quite low. He had been restricting water for years trying to address this, but he was drinking iced water throughout the evening because, as he put it tastes better. His bladder function testing showed classic detrusor overactivity. We made 2 changes. We increased his total daily fluid intake and switched all evening fluids to room temperature or warm herbal tea. Within 8 weeks, Harold was consistently waking only once per night, and some nights not at all. He told me at his follow-up appointment that he had forgotten what it felt like to sleep through until 5 a.m. He was 72 years old and still getting better. The Synergy Tip for Strategy 5. Pair warm evening hydration with a 5-minute pelvic floor relaxation practice before bed. Slow, deliberate relaxation of the pelvic floor muscles while seated or lying down. Research from the Women's Health Foundation found that pelvic floor relaxation, not just strengthening, which most people have heard of, but deliberate relaxation reduces detrusor overactivity in older adults by calming the neural feedback loop between the pelvic floor and the bladder wall. Warm water calms the temperature receptors. Pelvic floor relaxation calms the neural pathway. Together, they create the bladder quietude that sleep requires. Strategy number 4. Sodium, not fluid volume, may be the primary driver of your nighttime urination, and reducing the right kind of sodium at the right time of day can cut your nocturia episodes in half within weeks. This is one of the most under-discussed findings in urological research of the past decade, and the reason it is under-discussed is uncomfortable. It implicates not how much people drink, but what they eat. And dietary counseling, as anyone who has sat in a doctor's office knows, is rarely the center of the conversation. Here is the mechanism. Sodium salt is an osmotically active substance, which means it pulls water with it wherever it goes in the body. When you consume sodium, your kidneys must eventually excrete the excess, and they do so by pulling water along with the sodium into the urine. High dietary sodium directly increases urine production. This is straightforward physiology. What is less widely understood is the timing relationship between sodium intake and nighttime urine production. After a meal high in sodium, the kidney's sodium excretion process peaks approximately 4 to 6 hours later. So if your highest sodium meal of the day is dinner, which for most people it is, because dinner tends to be the largest and most elaborate meal, the sodium excretion peak occurs at 11 p.m. to 2 a.m., which is exactly when you are trying to sleep. Your kidneys are producing their highest nighttime urine volume at the precise hours when your bladder needs to be quietest. A landmark study published in the journal PLOS One by researchers at Nagasaki University Hospital, a study that genuinely surprised the urological community when it was published, followed 321 adults with nocturia over 12 weeks. The intervention group received targeted sodium reduction counseling, specifically focused on evening meal sodium content. The result? Average nighttime urination dropped from 2.3 episodes per night to 1.4, a reduction of nearly 1 full episode per night, with no change in fluid intake whatsoever. Reducing evening sodium alone produced a 39% improvement in nocturia frequency. After age 70, the kidneys become less efficient at processing sodium. Their filtering capacity for sodium has declined by approximately 30 to 40% compared to younger adults. This means sodium stays in the system longer. Its diuretic effect, its water-pulling effect, is prolonged, and the nighttime urine production it triggers extends further into the sleep hours. An older adult eating a high-sodium dinner is essentially programming their kidneys to produce maximum urine during maximum sleep hours. The practical intervention: audit your evening meal for hidden sodium. Restaurant meals, canned soups, processed meats, bread, cheese, sauces, and condiments are the primary sodium culprits, and their sodium content is rarely visible on a plate. A single restaurant entree can contain 2,000 to 3,000 milligrams of sodium, well above the 1,500 milligram daily recommendation for adults over 65. Cook dinner at home with herbs and spices rather than salt where possible. Read labels. Prioritize low-sodium options, specifically at the evening meal. The morning and midday meals carry far less risk for nighttime urinary impact. The synergy tip for strategy 4. Pair sodium reduction at dinner with a potassium-rich component of the meal: sweet potato, banana, avocado, leafy greens, or white beans. Potassium and sodium have an inverse relationship in kidney management. Higher potassium intake directly promotes sodium excretion during waking hours, rather than banking it for nocturnal release. Think of potassium as the daytime shift worker who takes care of the sodium before the nighttime crew has to deal with it. Before we reach the top 3 strategies, where the most powerful and most counterintuitive information lives, I want to take a moment. If this video is giving you a genuinely new understanding of a problem that has been affecting your sleep, your energy, and your daily life, please subscribe to this channel right now and give this video a like. The algorithm that determines who sees this content responds directly to those signals, and there are older adults watching right now, or who will watch tomorrow, who need this information as much as you did before you pressed play. Subscribe. Like. Let us make sure they find it. And now, the top 3. Strategy number 3. Leg elevation in the afternoon is one of the most effective and most overlooked interventions for nighttime urination, and the reason it works will change the way you think about where your nighttime urine actually comes from. Here's a piece of physiology that almost nobody outside of urology and nephrology knows, and that I consider one of the most practically important facts I can share with older adults. During the day, when you sit or stand for extended periods, fluid accumulates in your lower legs, in the tissues, not just the blood vessels. Gravity pulls fluid downward, and in older adults, whose vein valves are less efficient at pumping blood back up to the heart, this fluid pools. You may notice this as mild ankle swelling at the end of the day, what physicians call dependent edema, which simply means swelling caused by fluid collecting in the lowest available position. This is the key. When you lie down to sleep, gravity is removed. The fluid that has been pooling in your legs all day is now free to reabsorb into your circulation. Your blood volume increases. Your kidneys detect the increased volume and respond by producing more urine to bring the blood volume back to normal. This is not a bladder problem. It is a fluid redistribution problem, and the urine your kidneys are producing at 1 a.m. may have nothing to do with what you drank at 8 p.m. It is the leg fluid from 3 hours of sitting in your recliner after dinner, finally returning to circulation when you went horizontal. A study published in the journal JAMA Internal Medicine by researchers at Loyola University Medical Center found that afternoon leg elevation, lying with legs elevated above heart level for 30 to 60 minutes in the mid-afternoon, reduced nocturnal urine production by an average of 42% in older adults with nocturia and dependent edema. 42%. From lying down in the afternoon. The mechanism is that afternoon elevation allows the pooled leg fluid to reabsorb during waking hours, when the kidneys can process and excrete it before bedtime, rather than holding the reabsorption for the horizontal hours of sleep. After 65, venous insufficiency, the reduced capacity of leg veins to return blood efficiently to the heart, affects a significant proportion of adults. The leg muscles that pump blood upward against gravity are less active due to sedentary habits, and the vein valves themselves become less competent with age. Think of the veins like one-way escalators. When the escalator mechanism weakens, fluid pools at the bottom floor. Afternoon elevation is like manually carrying that fluid to the upper floor during the day, so it does not all rush up at night. The practical implementation. Schedule 30 to 45 minutes of leg elevation each afternoon between 2 and 4 p.m. Lie on a couch or bed with your legs elevated on pillows to a level above your heart. Your hips should be flat or slightly lower than your calves. This is not a nap, though if you sleep briefly, the timing is acceptable. The goal is horizontal leg positioning for sufficient duration to allow the accumulated leg fluid to reabsorb into circulation during waking hours. If you do this consistently for 2 weeks, measure the change in how many times you wake at night. The research predicts you will be surprised. I treated a woman named Patricia, 74, from Baton Rouge, Louisiana. Patricia was waking 2 to 3 times per night despite having reduced her evening fluids to almost nothing, a habit that, as I explained earlier, was creating its own problems. Her lower legs showed visible puffiness by the end of every day. We implemented afternoon leg elevation and, simultaneously, increased her daytime fluid intake to properly hydrated levels. Within 3 weeks, she was consistently waking once or fewer. At her follow-up, she told me something that moved me. She said, "I have not slept this well since my husband was alive." She was talking about years of disrupted sleep, years resolved by understanding where her nighttime urine was actually coming from. The synergy tip for strategy 3. Combine afternoon leg elevation with compression stockings worn during the day, specifically graduated compression stockings of 15 to 20 millimeters of mercury, which are available without prescription. These stockings provide gentle, consistent pressure on the leg tissues throughout the day, significantly reducing the amount of fluid that pools in the first place. Less pooling during the day means less redistribution at night. Research from the Journal of the American Geriatric Society found that adults who used compression stockings during waking hours and practiced afternoon elevation showed a 58% greater reduction in nocturia than those who used either intervention alone. Strategy number 2. The 2-hour fluid cutoff before bed is not wrong, but the way most people implement it is, and the common implementation actually makes nocturia worse by concentrating the wrong things in the bladder at the wrong time. Let me explain this carefully because it is subtle but important. The conventional advice, "stop drinking 2 hours before bed," is based on the physiologically correct observation that the kidneys take approximately 90 minutes to 2 hours to process a fluid load into the bladder. If you stop drinking 2 hours before sleep, theoretically the bladder should not receive significant new urine volume for the first portion of the sleep cycle. This logic is sound. The problem is in what most people do during those 2 hours. What typically happens, knowing they cannot drink, people compensate by consuming more fluid in the hour or two before the cutoff, often including alcohol, caffeinated beverages, or sodium-containing drinks and foods that they consider liquid. Wine with dinner, decaffeinated coffee that is not actually caffeine-free, a large glass of juice, soup. Then the cutoff begins, and the kidneys spend the 2 hours before sleep aggressively processing this concentrated, often irritant-containing fluid load, filling the bladder with concentrated urine that contains alcohol metabolites, residual caffeine, and high solute content, all of which irritate the bladder lining and trigger urgency even at lower volumes. After 70, the bladder lining, the urothelium, becomes thinner and more sensitive to chemical irritation. Think of it as the difference between thick rubber gloves and thin latex ones. The same chemical that barely registers through thick gloves burns through thin ones. An older bladder is the thin latex version. Concentrated, irritant-laden urine that would pass through a younger bladder without triggering urgency will reliably trigger an overactive response in an older one. So the 2-hour cutoff, properly intended to give the bladder a rest, is being filled with the most irritating urine of the day. A study from the Bristol Urological Institute found that the composition of urine in the last voiding before sleep was a stronger predictor of nocturia frequency than urine volume adults whose pre-sleep urine contained high concentrations of caffeine metabolites, alcohol metabolites, or osmolality. a measure of how concentrated the urine is. Experienced nocturia at rates 61% higher than those whose pre-sleep urine was dilute and irritant-free. The practical correction transforms the 2-hour cutoff into an active intervention rather than a passive restriction. In the 2 hours before bed, drink small amounts of room temperature water, not large volumes, but enough to maintain gentle kidney filtration that produces dilute, low irritant urine. Avoid alcohol entirely in the 3 hours before bed, not just 2, because alcohol's diuretic effect, which comes from its suppression of ADH, the water-conserving hormone, peaks approximately 90 to 120 minutes after consumption, and then continues for several hours. Avoid all caffeine, including so-called decaf, which contains 15 to 30 milligrams of caffeine per cup, enough to affect bladder sensitivity in older adults after 2 p.m. And avoid high-sodium foods after 6 p.m., as we discussed in Strategy 4. The goal is to arrive at bedtime with a bladder that contains dilute, low-irritant, low-volume urine, a bladder that has no urgency signal, no chemical irritation, and sufficient capacity to remain comfortable for a meaningful stretch of sleep. The synergy tip for Strategy 2. Add 1 cup of chamomile or valerian herbal tea, both caffeine-free, approximately 90 minutes before bed as your final fluid intake. Both chamomile and valerian have mild bladder-relaxing and nervous system calming properties documented in research. The warm temperature calms detrusor activity, as we discussed in Strategy 5. The fluid volume is small enough that it is processed before deep sleep begins. And the anxiolytic, meaning anti-anxiety effect of these herbs reduces the hypervigilance about urination that many people with nocturia develop, which itself can become a trigger for waking even when the bladder is not genuinely full. And now, strategy number 1. The approach that is most counterintuitive, most consistently overlooked, and that addresses the single most important physiological driver of nocturia in older adults, one that has nothing to do with what you drink, when you drink it, or what temperature it is. The most powerful strategy for reducing nighttime urination is restoring the ADH surge, the nocturnal antidiuretic hormone rise that tells your kidneys to produce less urine at night. Through a combination of interventions that most urologists never discuss because they fall outside the narrow frame of bladder management and into the broader territory of circadian biology and lifestyle medicine. Let me explain what ADH is and why its decline is so central to this problem. Antidiuretic hormone, also called vasopressin, is produced by the hypothalamus, a region deep in the brain, and released by the pituitary gland, a small gland at the base of the brain. Its job is simple and powerful. It tells the kidney tubules, the microscopic tubes inside the kidney, where urine is concentrated to reabsorb water back into the body rather than releasing it as urine. When ADH is high, urine production slows dramatically. When ADH is low, urine flows freely. In healthy younger adults, ADH rises naturally and substantially in the first few hours of sleep, reducing nighttime urine production by 60 to 70% compared to daytime rates. This is what allows a 30-year-old to sleep 7 or 8 hours without waking. After 60, ADH production begins to decline in reliability and amplitude. The nocturnal surge becomes blunted, and some older adults lose it almost entirely. Without the surge, the kidneys produce urine at nearly daytime rates throughout the night. The bladder fills, the person wakes, often 2, 3, or more times. They need this information, and the people around them probably have no idea how to help. And before you go, leave me your answer in the comments. How many times do you wake up at night right now? And which of these 6 strategies are you going to try first? Tell me your age too. I will read every response. I always do. And I will see you in the next video.